Welcome everybody. According to my timekeeper, it's now 7 o'clock, so we shall kick off. Agenda item number 1 is apologies for absence.
Thank you, Chair. Yes, we have apologies from Councillor Burbage, Councillor Hemraj, Councillor Kiom and Councillor Ansar Ali, and we have Councillor Ishfaq Hussain here as a substitute. And we also have apologies from Sakib Rehman as the Health Watch representative.
Thank you, Pippa. Agenda item 2 is declarations of interest and any whipping declarations. Nope. Jolly good. Agenda item 3, minutes of the Health Scrutiny meeting held on the 11th of January 2022. I need those of you who were there. Are they a true and accurate record, and are you happy for me to sign them off? Yep. Okay, brilliant. I'll sign them for you, Pippa. Agenda item 4, call in of any cabinet member or key officer decision.
Thank you, Chair. There are no call-ins for this meeting.
Lovely, thank you. Okay, agenda item 5, which is the report on the Urgent Treatment Centre and GP out-of-hours services in Peterborough City Hospital, post-relocation from Peterborough City Care Centre. I understand that Phil and Taff are presenting, is that right? Good evening, gents.
Good evening.
You need to press the big button in the middle.
It's obvious when you know how, isn't it? Good afternoon, and thank you for inviting us back. I think I can summarise it down and take questions if that's okay. So the Urgent Treatment Centre went live on the 1st of July last year. It's now been in position for nearly 9 months, and it has seen its impact has largely been as expected. It is performing well in terms of seeing a larger number of patients than it had been doing when it was at the Peterborough City Care Centre. And it continues to deliver a fairly fast turnaround, albeit not as high as we would like. Key issues for the Urgent Treatment Centre has been recruiting staff, particularly at the specialist end. So for us, GPs and advanced nurse practitioners. So we've been out to the market several times, and I'm sure that members will understand that recruiting general practitioners at this point in time, particularly in Peterborough, is very difficult. So we have got one person in place, and we have another person starting in May. We are filling those gaps with emergency department medical staff, largely consultants or senior middle grades. They are not as good in the Urgent Treatment Centre as a general practitioner, because a general practitioner has a better concept of what can be managed in the community, whereas A&E doctors do what A&E doctors do, which is manage resuscitation and acutely unwell patients, and the mental mindset is different. We have been able to recruit a number of advanced nurse practitioners who are able to support the Urgent Treatment Centre, and that has worked really very well. So it is a really good piece of work, and we've had several national teams come up from London, from Cambridge, to look at the model, and have essentially walked away and said, it's very good, you just need to do more of the same, please. So it is considered to be a very good model of care, and it's a single point of entry, which means that we can determine the best route of care for patients. There was, I believe, a concern around the impact on car parking and the potential surrounding areas. Because of COVID, a lot of our patient activity went to, particularly for outpatients, went to non-face-to-face, and we've actually been able to maintain quite a high number of non-face-to-face outpatient appointments. So we've actually seen a diminishing of the number of car park demands from the public, even after the urgent treatment centre is up and fully running. So, and we did have some previous concerns from the surrounding neighbourhood, but we've had no further concerns since the opening of the urgent treatment centre. So, in summary, a qualified success, and that's largely been because we've just not been able to recruit to those last few GP posts, but we are still out and we will continue to push on that. And the concern around the car parking has not materialised in the way that I think was worried about. I'll stop at that point and take any questions.
Councillor Ball.
Thank you, Chair. If we could turn to page 17, paragraphs 1 to 4, how have you calculated the performance improvement percentages, given that the data set is different to that of Thorpe Road? Are you comparing like with like? And I fully understand how you can compare against the national clinical indicators. The measurements given on page 20 seem different to what's been presented to us before. And can we have Peterborough's data sets compared to the national clinical indicators, please? Thank you.
So, with regard to the first question, the performance against the Peterborough City Care Centre is actually less at the urgent treatment centre, and that's partly because we are seeing more patients go through. We're seeing about another 50 patients going through every day, over and above those that had been going through the City Care Centre. So we're not in a position to do a like for like because the cohort is different, the numbers are different. What we know is that the more patients we can manage through the urgent treatment centre, the better, because it is a better model of care. So I'm afraid we can do a like-for-like comparison, but it's not a like-for-like. But we can certainly get you those numbers from before and after. I know Thorpe Road was delivering at 95% plus, so you can see that the performance has dropped, and the performance has dropped nationally, but it is a slightly different cohort of patients. There is around 60 patients a day who would previously have gone through our A&E department who are now going through the urgent treatment centre. The national position for our A&E department in total, I think that was your third question. So again, yes, we can get you that information, but we are not performing well on the national performance. There is a national drop in performance, so it has been quite significant. We have mirrored that drop, but we started with a lower performance, so we remain in one of the bottom 10 A&Es in the country. So we still have a significant problem in terms of our what is known as type 1 activity, and that's the patients who are coming in because they will require admission in the main or they are acutely unwell. So those are the non-UTC patients. That performance is very poor, and it's bringing down the overall performance across the A&E department.
Thank you. Councillor Barkham.
Thank you. Hi.
More afternoon.
Why do you struggle to get GPs for this unit?
The simple answer is hen's teeth. I think they are. There's been a lot of demand on GPs. I have a lot of friends who are GPs, and what they tell me is that the pressure that they've faced over the last 2 years has been really very difficult and continues to be difficult. So there's been a number of people who have left rather than continue to work. It is actually quite an attractive post because it allows GPs to bridge between A&E and their primary care kind of practice. But we are struggling to recruit GPs in totality. It's not just the A&E, it's not just MWAFT. They are difficult to recruit across the country, and there is a national shortage of GPs. And we're just reflecting that.
Thank you.
Councillor Farouk.
Thank you, Chair. Just relating to page 17, service delivery and impact on patient access, you mentioned that the urgent treatment centre is often used as essentially an offloading bay, short-term offloading bay, which in essence I suppose would limit the amount of ambulances that are waiting to offload patients to A&E. Just wanted to clarify whether this has any impact on the services and resources available at the urgent treatment centre and whether it impacts patient waiting times?
So we've had to, on occasions, manage patients into the urgent treatment centre, as you say, so that we can move patients off the back of ambulances. We do that out of the normal working hours of the urgent treatment centre. So, excuse me, we will do it overnight so that we can make sure that the ambulances are back on the road as fast as possible. And these are patients who will have a plan to be leaving the urgent treatment centre first thing in the morning. So I tend to get to work before the urgent treatment centre opens. I will walk through, I'll note any closed doors, and I'll make sure that there is a plan to move them out before the 8 o'clock start for the urgent treatment centre. There have been 1 or 2 instances where we have been unable to move them out before the urgent treatment centre opens. But because the build-up of activity tends to be fairly slow, it moves from sort of a lightish level of work at 8 o'clock. We're able to accommodate a patient or 2 in the urgent treatment centre for an hour or so, but we do get them out before it becomes an impact on our ability to cope with urgent treatment centre activity. Does that make? That was a very long-winded way of saying we have to do it occasionally overnight, but it hasn't affected our ability to manage urgent treatment centre activity to date.
Yep, thank you. I just have one follow-up, Chair, if that's okay. Sorry, you led on to it quite nicely. It was about the shift patterns and opening times. So it's 8 a.m. till 8 p.m. service at the moment. However, you mentioned that after staff consultation, some shift patterns would change to suit the service better. Would this still then be an 8 till 8 o'clock service, or what is that looking to change to?
So at the moment we're considering an 8 till 12 because what we're seeing is peaks of activity. So there used to be a peak of activity at 12 and a peak of activity at 6 for A&Es, and it would stay high until about 8 or 9 o'clock and start to diminish. What we're actually seeing is a peak of activity at 12, at 6, and now one at 8 that picks up and keeps going. I know quite a lot of that work would be manageable through an urgent treatment centre. So the intent at the moment is to work with the staff and try and expand through till midnight.
Thank you. Councillor Boyce.
Thank you, Chair. On page 17, you've said you have additional investment in the recruitment of more emergency practitioners.
Yes.
How many were you looking for, and how many of those posts have been filled to date?
So we're looking to recruit to about 7. At the moment, we're on about 5. Yeah. And they're the staff that I talked about in terms of an adjunct, so they work at quite a high level, and I've been seen by an EMP on before. They are able to support the totality of the work that we do. They're independent practitioners. Again, quite difficult to get hold of.
Councillor Fruit.
Thank you, Chair. Just at the bottom of page 18, you've mentioned the percentage of virtual outpatient appointments using telephone or video has increased from prior to pandemic. Do you know what percentage of total appointments would be virtual? And then as a sort of second question, the percentage of, or roughly the percentage of appointments that are, or people that walk into the service versus the NHS 111 appointment booking service?
So if my memory serves me correctly, it's about 28%, which is one of the better performances in the east of England. In fact, last time I looked, it was the best, but there are a lot of people vying for that. I will get confirmation of that just to be absolutely certain, and that is follow-up patients. So we've been able to maintain, I think in the peak of pandemic, we were around 50%, but that was through necessity. As we have been able to see patients, I think a lot of the medical staff are still very keen to see them, so we have seen that drop down. But as I say, I remember it being at 28%, which is still a very good performance. With regards to the number of patients coming through directly from 111, they're still very small numbers. We're working with them every single day to try and encourage the use of the urgent treatment centre, but IT is getting in the way. So my recollection is, again, it's in single figures on a daily basis, but I will confirm that.
Thank you, Chair. Really, for me personally, it's a thank you, because I unfortunately had to use the system at the urgent care centre just after Christmas, and from turning up to actually being discharged from the hospital after seeing a consultant was less than 2 hours. Excellent. It was very, very slick, and that included having an X-ray. So really, just a thank you.
Glad to hear it. That's exactly, I'll feed that back, but that's what we've got to try and improve on and maintain that level. But more patients going through there is just, it's better all round. So it is genuinely, I've worked in a lot of hospitals, it's the best urgent treatment centre model I have seen. It's the best front door model I have seen in an A&E department. So I'm glad it worked for you.
Councillor Rush.
Thank you, Chair. It's encouraging to see that this is a success. I know this committee, there's not many on it left now. I know it was on one of the original ones. And Councillor Ball, we've been pushing this for many years with the CCG to have a front of house department in front of the hospital. So it's very encouraging to see it's a success, and that other health authorities are coming to look and perhaps take on board what is happening. In the past, we've asked if we could have a visit. I mentioned in here that you're still encouraging us to visit. Do you know, because I know COVID's still around, people still getting COVID, any chance of when we could be able to do a visit?
You are welcome any time. We take full precautions, so you would be asked to wear masks and clean your hands, etc. But there is no reason. We have a number of visitors who have been to see the site. You are right, we are seeing something of a surge in COVID activity at the moment. So I would probably ask if you can give us 2 or 3 weeks just for that surge to settle down. But any time after that, you'd be very welcome.
Thank you. And I could ask Pippa if she could make a note of that, please, and whether it would be you or whether it would be Paulina. Perhaps in the near future we could arrange a visit for the committee to go and have a look at the new facilities, please.
Councillor Harper.
Thank you, Chair. Through you. First time on committee, lovely to hear some really good news with that. I just wondered if we could dig down a little bit and think, with the percentage of people that are being seen virtually, as you mentioned, does some sort of survey take place of those patients that they are actually happy to be seen virtually? You might offer it, but is that all they're offered, or would they be offered, yes, you can have face-to-face or virtual, or is it just you only offer virtual so they don't know they've got the option? So I'm just thinking some people may just go with it so they get an appointment effectively. So I just wondered how you're checking that your 25% is not a target that you want to reach. It's a target that just happens to have happened because people are willing to accept it. Do you see where I'm coming from? You're not pushing that.
Absolutely. So it varies according to specialty, and that's the slight nuance that I'll need to build into that. We do routinely offer a choice, but there will be some specialties that, and particularly with long-term follow-ups, where we will say it's a virtual, or it's and indeed we're moving quite a lot to patient-initiated follow-up. So we say you have been discharged, but if you do need to come back for any reason, including this and this is how you can book yourself an appointment straight back in. So what I can do, again, I will follow up just to let you know where the offers are made, how the offers are made, and what the satisfaction surveys that we're getting back on this looks like. What we know is prior to COVID, literally about half of patients attending outpatient follow-up appointments saw no value to them at all. So, and roughly about 45% of the consultants and the senior doctors also didn't feel that it added much value to the patient's life. So I think there is still some way that we could get to, but you're right, what we don't want to do is hit a target, miss the point kind of thing. It's very much about making this the right way for patients to see the medic that they need to see. I'll get back to you on the actual numbers around that because I haven't got them to hand.
Yeah, sure. Yeah.
Another question that came in, you mentioned, and it's in the report, about because the biggest worry that was going through all the media and everywhere else was obviously parking. and that hasn't materialised. But then, of course, you've had the change of how many people can visit, how many people can go to clinics, etc., as you said. So are you going to looking to do that survey again? Because now I know the hospital's opening up a bit, although maybe what's going on, it's gone a bit more restricted again. But when it becomes effectively full-time visiting and full-time, or 75% if you're a lucky clinic, appointments, are you going to look and do it again then, the actual survey? Because obviously that's when it's realistic. At the moment, to be fair, you could say, well, that's because nobody's parking in there hardly, because they're not coming.
It's absolutely a fair point. We monitor the car park utilisation very carefully, and to be honest, as the director with the responsibility for estates, I can tell you almost on a day-by-day basis, because there is income associated with patient parking. We know that our income is down by quite a long way, so we know as a consequence that our parking demand is down, so we keep a really close eye on that. It's our way of monitoring car parking utilisation. If it starts to look like it will get close to 100%, then we'll start to manage it differently, but at the moment we're quite a long way away from it, so it's almost a sort of week by week monitoring that we're doing on this.
Yeah.
The last one, this is more of a medical thing. If somebody turns up an A&E effectively and needs to go, it would be better off in the urgent care. Is that exactly where they're signposted to?
Yep.
So you always push A&E, push them away from A&E if you think you can deal with them in.
There is a single front door. Somebody triages you as you come in and directs you to the urgent treatment centre, to majors, to sit in paediatrics, to wait in the waiting room, or if absolutely necessary to take you straight through to resus. So that's the beauty of having that front door system set up, is that a practitioner can decide what is the most effective use of your time and the A&Es.
Thank you. Councillor Farouk?
Thank you, Chair. It's a bit of a generic question. I just wanted to clarify that I work in a different trust, you see, and one of my roles is I'd have to communicate urgent results to GPs, and appreciating that once GP surgeries are closed, it then goes through to an out-of-hours GP service. In our trust here, is that something that the urgent treatment centre takes care of, or does that go elsewhere?
So it would be anybody leaving the A&E department will get a discharge letter to the GP explaining that they've been in, that the results are there, and then there is an automatic way of sending those results on at a later stage if they're needed. So everybody coming in through the department gets a letter sent automatically, and that would be the same for the urgent treatment centre.
Thank you. Councillor Ball, did you put your hand up?
Thank you, Chair. You mentioned that other trusts have been visiting to see our UTC model, and you said that they commend it on the whole. Do you actually know how many have actually gone forward to implement this model, or are they just picking and mixing some of the things that you've got on offer? And by the way, my experience wasn't as good as Councillor Boyce's. I perhaps came at the wrong time, first week in December, and it took 5 hours for someone to see me, and it was in COVID-restricted period, and I had people sitting closer to me on my left and right-hand side than here, so my experience was not at all good, and I was red-wristed. So you know what that means.
I will apologise for that. Be interested to know more details, and we can follow up on that.
Okay, happy to do that.
Yeah, the other people have emulated this as best they can. I think what we need to remember is that there was millions of pounds invested in us being able to actually build something on site that was within the A&E department. If you go to Leicester, for instance, they've got an urgent treatment centre next door to their A&E, but it's a separate entity. There are other places that have got urgent treatment centres nearby or somewhere within the building. For us, the beauty is that we have got that single front door, and you can turn right to go to the urgent treatment centre or straight on to go into the A&E department. And it's a modular build, but when you come round, you'll see you wouldn't know it. It's not the old springy floorboards that I expected. It's completely solid. It really feels quite a proper build.
Yeah, I have been there.
Yes,
and walked
obviously.
through the
Yes.
walked and had 3 consultants, I have to tell you. I've virtually seen every square of it. Yeah. Yeah, so it's heartening to see that some are picking up on the model and looking at that single front door access.
And quite a few other organisations have asked for our pathways and our standard operating procedures because they are seen as. So even NHS England have been up to have a look at it and have their expert came up and essentially said, this works very well, you just need to do more of it. Yeah.
Thank you. I think that ends the questions. Does anybody have any recommendations? No? Okay, thank you, gentlemen.
And can I just thank the 2 councillors over there for your ongoing support, because you've obviously helped us to get to where we wanted to be.
Now, I'd just like to say for you to thank all your staff in the department for making it such a success. And thank you very much.
Thank you.
Thank you, gents. Okay, agenda item 6 is the Mental Health Section 75 Partnership Agreement Annual Report, and we welcome Lisa Sparks. Can you put your mic on, please? That's it.
There we go. Right. So the mental health services to support the people of Peterborough are delegated to our partners CPFT through the Section 75 agreement for mental health. So the report that we provided you with just provides an overview of the service and financial performance within this year. So if I just basically explain some of the sections. We've included some information on the annual investment. The annual investment for this year will not change for 2022-23, so we'll have the same level of funding. The key performance indicators have remained the same. In terms of staffing, there has been some movement in staffing, mainly as people have progressed within the organisation, which has left some ongoing vacancies, which CPFT are trying various avenues to try and fill at the moment, but essentially they're having very similar problems to the rest of the sector in terms of we have similar issues in filling social worker posts as well, but they are looking at potentially doing some restructuring within the team to make some of those posts more attractive. We've provided you with some information on care packages and also the financial performance, which has been supplied by our finance colleagues. In terms of patient numbers, the numbers actually remained relatively static throughout the period, and at present the financial situation is looking quite positive, with an expected underspend by the end of the year, unless we see a significant increase in new packages coming through in this last quarter. We've provided some information around the annual social work plan to give some idea of what's actually happening. The annual work plan is discussed and managed under the Section 75 Partnership Governance Board, so that has regular oversight and updates are taken there as well, and any issues can be discussed. Within 4.7 we've tried to provide some examples of some of the outcomes that have been delivered by the service. And we've set out our priorities for 2022-23, And there's also a note there just regarding the integrated care system and the fact that we will be looking at whether or not mental health section 75 arrangements need to be adjusted to align with the new ICS arrangements when they're in place. Does anyone have any questions?
Okay, thank you. Questions? Councillor Boyce?
Thank you, Chair, through you. On page 65, it shows that you've had an increase in the adult mental health home care, but then the financial breakdown shows £120,000 saving. Can you explain where that savings comes from?
Sorry, my page numbers are slightly different to yours. I can't provide you with a detailed breakdown of what's been provided financially, but we can take the question back to our finance colleague who's provided us with all the figures and the data, so we can certainly get an answer from you from him, if that's okay.
Yeah, fine, thank you.
Thank you. Councillor Ball?
Thank you, Chair. Page 66, paragraph 4.5. Why or how can you predict a reduction in the cost of care when the numbers remain relatively static and the Council's direct payments for mental health care, which obviously are means tested, also remain fairly static? So I'm not quite understanding where you're going to get your reduction from. Thank you.
So it can be just in terms of the value of the package. Although the numbers may change, they're often very high cost packages, so just a change within one or two packages can lead to a substantial saving over the period.
Councillor Farouk?
Thank you, Chair. My question is relating to the number of direct payments made. Do we have any sort of breakdown over or what these payments are issued for? See, I'm a little bit cautious whenever I see sort of direct payments, because there's often no follow-up of whether these achieved what was set out to achieve. So do we have any sort of indication or follow-up that these are in fact helpful? Or
I can't give you a breakdown of what they would include, Shona. I don't know if you can give an indication of the sort of support that would come through those. Big one, that's it. Oh, okay.
Yeah, and I take it as read that you understand the whole person-centred nature of direct payments being awarded, and it's really very much about aiming to achieve the outcomes that the person wants to achieve. We do keep, from a practice perspective, a very close eye on when direct payments are used, because what we don't want to see really is that a direct payment is in place, but traditional forms of support are still being purchased, i.e., through a domiciliary care agency, for example. So the review does take all of that into account to ensure that it is very much focused on the person and what it is that they want to achieve in their life. Sorry, I can't give you, I'm not giving you very direct sort of answers, but it is very much based on what the person dictates, and we very proactively support and the access to advocacy to ensure that the person's voice really comes through that professional intervention.
Thank you. Councillor Barkham?
Thank you, Chair. Hi. It's a question just relating to mental health. It's quite a tricky subject really within medicine. A few people contacted me who've experienced or mental health difficulties when they approach the NHS. The NHS is quite poor with regards to helping people unless they're at a point where they need committing, for example. There is a person who is healthy, a person who has mental health issues, but if they can no longer function, the NHS can then get involved, but the middle ground, there's no help. It's like, so what does a person, what's the criteria attached to accessing that services? How bad do they need to get? And separate question, related, what preventative type work do you do? Because the top section is early intervention, prevention and mental health. So what preventative work do you do? Thank you.
So I think it's useful just to reiterate that we are adult social care social work based within an NHS trust. So we absolutely work to the Care Act and are not governed by conditions and treatment as such. For the Peterborough area, very interestingly, you'll note in the report that we describe our involvement with the Exemplar project, which was an early implementer site to actually cover that perception of barrier between primary care and secondary mental health care. So over the last year, we've recruited 2 full-time social workers to actually work within the community to give that overarching preventative approach to involvement with adult social care services. In terms of access to the service, there is a process in terms of identifying eligible and non-eligible needs under the Care Act, but interpretation of that is quite varied in terms of mental health services. So in terms of a couple of examples from the Exemplar project that covers North and South Peterborough, we've worked quite extensively on housing applications. We've worked with access to welfare benefits advice, so very much taking a proactive approach, not waiting for people to deteriorate so that they actually need to then move into mental health services. We've put together a couple of scenarios, just to give a flavour of what the difference has been from us being very involved with primary care and the community navigators and social prescribers, and it's very much about welfare benefits, it's about housing applications and about supporting people on their journey to access community resources. I'm sure you know How Are You Peterborough website, which is developed, and that has been a fantastic resource in terms of community connectedness and our role in supporting people to find out what's in their local community for them. So I think we hope that's just going to build and build.
Yeah. Thank you. Very detailed. Just briefly then, so the preventive work that you are doing, where you're trying to limit them progressing further with their mental health services, do you have any details on that, regardless of how many people you may have helped not progress?
I think it's quite a difficult it's quite difficult to report on what hasn't happened, but we do have the figures in terms of the number of people that we have effectively supported through this early preventative work. And talking straight off the top of my head really here, but I mean we could get the numbers for you if you wanted to have the actual numbers. We've got really healthy caseloads with the 2 social workers, so a level that one might expect, but if you do want the actual numbers, we can put those together for you, because we do keep an eye. And of course all of our performance reporting goes through our Mosaic case management system, so that wouldn't be too difficult to get the numbers of people, but it's very difficult to say how many people we've prevented deterioration in, because we've been quite successful really with some complex cases. I don't know if that's answered the question. It hasn't.
Briefly, it probably has, partially.
We do also have other services that work in the community. So, for example, Peterborough City Council put funding into the CPSL Mind Good Life service, and that's obviously focused on helping people with their mental well-being through things like good mood cafes where people can go along whenever those sessions are running. There's also some support delivered through that service for people under Section 117, but it's very much around that kind of preventative sort of mood building and just helping people to manage every day in a supportive environment.
I understand it's probably easier to put a potential cost on people that you do work with, because then you have X amount of patients and they've cost X amount to the foundation, and it's probably more difficult to work out how much we haven't paid on somebody because we've prevented that. But that's quite a positive report to present, to say we've saved these people the mental health decline, for example, so that service needs promoting. It's just a positive message to share, rather than this is how much it's cost because these people have suffered. Well, these people, we've tried to prevent the limit of suffering, and then in turn we've saved X amount on the services that we don't need to provide now. It's just a positive message to share, and I think it's something we need to encourage more of. But thank you.
Do I have any more questions? Councillor Farouk, then Councillor Ball.
Thank you, Chair. Sorry, just a last one from me. How are referrals in general from GPs and more importantly, once these referrals are made, is there ever any sort of breach where these patients are seen, or are we generally quite good?
Sorry, you said a breach. I'm not sure what.
Sorry, yeah, perhaps breach is the wrong word, but if there's ever any delay in treating patients that have been referred, or if it's sort of quite a good service in general.
So with the placement of the 2 social workers within, to bridge the gap between primary care and work closely with the GP surgeries, we receive referrals direct from those surgeries and triage those. We don't have any unnecessary delays on that.
Councillor Ball.
Thank you, Chair. My question relates to page 69, paragraph 4.9. It's a very simple question, but it probably will have a very complex answer from yourselves. How will you go about ensuring alignment to the Section 75 arrangements with the new integrated care system? I know it's new and that you are dialoguing, but what are you actually presenting to make sure that there is that even playing field across all mental health issues and the providers?
And Debbie may want to come in here, but I think at the moment we don't really understand enough about the structure to know how that would work. As we've put in here, we know that there will be a provider collaborative that's focused on mental health and learning disability, but that's essentially the only level of detail that's been shared with us at this point. The plan is for regular updates to be shared, and then further discussions will take place as we go through. Debbie, I don't know if you want to add anything.
No, I think you're right, Lisa. So it is very early days. There will be 4 business units, of which one will be the Learning Disability and Mental Health Collaborative. But it is very early days in terms of how the ICS are structuring themselves, how the business units will structure themselves. The local authority are involved in all of those meetings, and so we're a key stakeholder. So we'll make sure that actually whatever model is agreed on, it will deliver the outcomes that we need to deliver, under our social care umbrella.
And may you indulge me by permitting me a secondary? How will this committee get to hear about that before it's all sewn up and dusted?
So so there is a draft paper now, again quite high level around the ICS and development of the business units. So a suggestion would be that actually that's presented to Scrutiny, and then as the work progresses, we can come to Scrutiny with regular updates, if that would be helpful.
Personally, because it's such a big shift. It is a very big sea change for me. I think that would be really informative and helpful. I can't actually make a recommendation that happen, or an action point that it may happen, because I'm only a co-optee, but I'm hoping that one of my supportive councillors might want to take that initiative up. Thank you.
Councillor Farouk.
Yeah, more than happy to make that recommendation.
Okay, so once we've finished the questions, we'll come to recommendations and actions. Do I have any more questions?
Councillor Sue, I just have just a point of clarification, because I think some of the questions, this is not about the treatment of mental health illness, which is the CPFT's responsibility. So I just think for some of the questions, it felt that some of the questions heading were, what are you doing about preventing or treating, or the time to get treatment for mental health, which is the responsibility of the Mental Health Trust. So I just wanted that clarification to be there.
Okay, thank you. Okay, so moving on to actions and recommendations. I think the action that was agreed upon, whilst you can't report on things that haven't happened, I've tried to turn it around, and my suggestion would be that the action would be that Lisa reports back to the committee with the number of interventions and how many of those interventions then escalate, rather than the ones that didn't escalate. Does that make sense? As in, once you've intervened, the number of people who then move on and still require further services, as opposed to those who don't require further services as a result of your intervention. Does that make sense? Is everybody happy with that? Yeah? Okay. And then Councillor Farouk, you want to put that forward, a recommendation?
Yeah, the recommendation that the paper on the integrated care system comes to scrutiny before release, and then regular updates as and when required.
I believe I need a seconder for that. Do I have a Councillor Harper? Thank you. You've got that noted. Okay, thank you. Thank you, Lisa. So we move on to agenda item number 7, which is the Adult Social Care Annual Complaints Report 2020 to 2021, and welcome to Belinda Evans. It'll come when you've got a red light at the top.
Thank you. Good evening. Sorry about that. They're new microphones to me. Good evening. I'm here to present the annual report for complaints following the adult social care statutory complaints process during 2020-21. So I manage the central complaints team. We take in all complaints about council services from the public, and this includes the complaints from care recipients and their family members. So my team monitor the delivery of complaint responses, but the responsibility for actually investigating and responding to those complaints sits with the managers in the individual social care teams within adult social care. The complaints we receive about adult social care mostly come to us by email or on our web page. We get about 30% coming in by telephone. The points I'd like to highlight to you in the report are that the complaint numbers have fallen over the past 2 years during the pandemic. Also that there are fewer complaints where we're finding fault during the investigations, and only a moderate percentage of complaints which have escalated to the Ombudsman this year about adult social care have been upheld. I hope you found the report of interest and would welcome any questions that members may have about the report. Thank you.
Councillor Boyce.
Thank you, Chair, and through you. Page 76, item 4.5, it relates to complaints responded to within 20 working days, which is hence a local target of those 20 working days. But overall, only 59% of those are being answered within the 20 days. Firstly, can you tell us what an actual response is? Is it just a telephone acknowledging or a letter acknowledging you've got the complaint? And then it gives not an excuse, but a reason for it, saying that delayed responses are often due to the need to investigate, which is quite right, I accept that. But is that the only reason why they're delayed, or is there an in-house reason within the City Council?
So when we accept a complaint, so with a statutory complaint, you have to make sure that it's coming from somebody that's entitled to use that process, and that the person who's making the complaint has consent. Because often with adult social care, those complaints come in from family members, and we need to make sure that they've either got power of attorney or they've been given the consent by the
the individual. So my team do that part of it, and within that first week, within 3 working days, we generally get an acknowledgement out to the customer saying, we've accepted your complaint and this is who it's being passed to. So they will know that their complaint's been accepted and when the response date is likely to be. Now we quote that 20-day timescale because management in adult social care in Peterborough have always been very keen to target a quick response. But it's not always feasible. Some of the complaints can be about multiple services. So, for example, it might be about a care assessment and it could be about care delivery at the same time. So you've got two different teams that need to look into their aspects. You will have seen that there are a number of complaints about providers. That involves the contracts teams going to the providers and asking questions that the customers put to them. So that will delay the complaints being responded to, especially where there are a number of teams that are involved in providing that response. The response when it goes is a fully written response from a lead manager who will pull together all of the points that need to be covered into one response, which will then go out to the customer. So I'm not aware of any sort of internal issues with complaint responses being delayed. The only thing I would say in the last couple of years is obviously there have been issues with things like getting complaint responses out because we've not had all staff in the offices, and also we've had obviously our own issues with staff being off with COVID, etc. So that will have probably had an impact in the last couple of years because I think the performance is slightly lower than it was before the pandemic.
Do I have any more? Councillor Ball?
Thank you, Chair. Could I turn to page 74, section 4.32, paragraph 1? Why do you think the contracts team and the independent providers received the most complaints respectively? And what, if anything, is the rationale for this? And how can it be improved? Thank you.
I think they've had a higher percentage of the complaints this time, and I think it is because of care delivery during this period has been very difficult. So obviously they've had issues with resourcing. So we've had more complaints about care not being provided on time. So somebody's got 4 calls a day and the morning call's been late. So if that happens continuously, then you will get a family member saying this is not on, so I want to make a complaint about it. Before the pandemic, probably a lot of those types of issues were raised once and dealt with by the adult early help team, who would speak to the contracts team, who would then speak to the provider and get it sorted out. But during the pandemic, I think it's been much more difficult for them to commit to those type of timescales and care packages.
I understand perfectly about the independent providers and the difficulties there, and obviously you would go back and hopefully there would be some learning lessons for them to take on board. The contracts team, what exactly does that do, and who does it mediate between at the beginning and the end of?
Can you just
explain? Basically, what does the contracts team do, and what's their function?
So,
and how can their performance be improved?
So I might have to ask Debbie to get involved here. I don't sit within adult social care. We're not in the department at all. So we liaise with commissioning and contracts and brokerage teams. And my understanding is that part of that service find care providers and set up contracts with them, and then they have contract managers who look after individual contracts and make sure that they're performing within those contracts.
Yeah, so just to put some context with that, in terms of, so at a very high level, Belinda, you're right, but we also have contract monitoring officers, so they have the relationship with the providers, and they will go out to ensure that the standard and the quality of the care and support being provided is meeting the expected levels. When we do have complaints that come in about providers, so it depends on the type of complaint. If it's fairly low level, or if it's, like later calls, etc., that will be managed quite quickly. But if there are more concerns, so if we're getting several complaints about a provider and we've got concerns about the quality of contracts monitoring officer will go out and do a visit. They'll go to the visit, they'll look at all of their training, their standards, their recruitment, all of that. So it's quite detailed in terms of the work they do, and that's really to try and improve and work with the providers, because providers are really important. And as there's a national shortage, so it's not to sort of wave a stick and say you're not doing a good job. It's how can we, the contract monitor officers are there to support them to make those improvements as well.
I get that the contract team do that, but why are they being hit by the number of complaints? Because it seems to me that they're part of the fix.
They are part of the fix, but if you look at the number of people that we support, we are supporting, I think it's in the paper, it's something like 2,800 people plus have had long-term care and support. So the numbers are relatively small when you look at the numbers that we support. And, this is people dealing with people, and sometimes things will go wrong. If somebody rings in unwell and they're able to attend a call and they've got to get that call covered, if that's your mum and her get-up time is 7 o'clock and she's left in bed and, she's not had a hot drink, etc., you're going to complain because actually that's not good enough for your mum. But sometimes there are exceptional circumstances. So we do work with the providers in terms of, well, how can we mitigate this? How can we ensure that, you prioritise your rotas so that those in greatest need get the earliest call when this happens. I think when you look at the number of complaints and concerns that are raised about providers in comparison to the number of calls that they're making and the numbers that they're supporting, they are relatively small, and there are always lessons learned, and when we've raise concerns with the provider, they will work with us to try and ensure that things are improved. And sometimes, depending on the gravity of the complaint, it will mean a member of staff goes through a HR process and, are no longer employed. But it does vary in terms of what the issue is.
It also might help me to explain that when we say that a complaint is against the contracts team, it's the contracts team that are trying to resolve the complaint rather than it being about them.
Absolutely.
With the adult social care complaints process, the customer can go directly to the provider if they want to. But if they come to the council, then we have an obligation to make sure that complaint is responded to. That's what the statutory process says. So the only time that a customer wouldn't come to us is if they've commissioned that care themselves, and then they can go straight to the provider, and if they're not happy with the response, then they can go straight to the ombudsman. But any case where we've commissioned the care, where the council's responsible for the commissioning of the care, then the contracts team have to take that forward for them. And a lot of customers prefer to come to the council and ask for it to be resolved through us. Maybe we're just more contactable, or that they get a fuller response.
That's more than helpful. That's getting at what my question was about.
Yeah,
Thank you.
I heard that. And also, just one other thing is that in the escalation appendix that are provided, there's one really good illustration of a contract complaint where you can see the provider providing a number of solutions, and those are obviously the provider being required to provide those solutions by the commissioning or contracts team.
Yeah. Thank you. Councillor Barkham.
Thank you. How do we compare against other authorities?
I'm so glad you've asked that question. We actually compare really, really favourably in Peterborough. So I meet with the other Eastern Region complaint managers that cover social care, both children and adults, every quarter. And throughout the pandemic, we would meet up, obviously virtually, and say, how are things going? And all the adult social care complaint managers would say, oh, it's terrible, we're getting more and more complaints, etc. And I'd say, well, we've not had any this quarter. And we see very low numbers of complaints in Peterborough compared to other authorities in our region, and compared to the Ombudsman, whereas they're seeing escalating numbers of adult social care complaints as well. I've checked the Cambridgeshire numbers recently, they've gone up. I did did a comparison peer review with Milton Keynes, which is a very comparable unitary authority like us, and I've just looked at their annual report, and they've seen very similar numbers to us, as they do in most other categories, and they've got a very similar sort of population size, etc. So that's probably one of the only other councils that I know that haven't seen escalating numbers. But in Hertfordshire, Lincolnshire, Leicestershire, the complaint managers there have all complained about higher adult social care complaint numbers during this period. So yeah, we must be doing something okay. And I do think that, you know, part of it is, and hopefully Debbie won't mind me saying this, but compared to a lot of other council departments, adult social care in Peterborough have got a very stable workforce. We've been dealing with the same managers in passing those complaints to them for 7-8 years. We don't see such stability in other parts of the council, particularly children's. There's a lot more movement of staff. So.
Thank you. Okay, great. It was actually going to be, why do you think that might be then? But you partially answered that about why we're doing so well compared to some others, but we don't know why specifically.
We just don't see, I mean, my team are very accessible. As I say, we get an increasing number of complaints now by telephone. We'll get family members calling us saying, you know, they've been advised to come to us because they've got concerns and they don't feel that they're being dealt with. The adult early help team and my team work very closely together, so anything that comes in that they can't resolve immediately will get passed to us, and we'll discuss if the complaints process is the correct process for it. So I don't think we're missing any. I really don't.
Of course you can, Debbie.
So the other, what we've really focused on is learning from complaints as well. So our quality and practice team will look at our complaints on a regular basis, and we have learning sessions with, you know, whoever.
It's recorded. It's live streaming, so you'll need. Oh, you're back on.
Oh, okay. Yeah, so I'm back on. So yeah, so I think that has really helped, so that people have a really good understanding. You know, and a few years ago, when I used to probably vet all of the complaint responses, I don't have time to do that anymore. It was about not being defensive and about being really open and honest. You know, if we hadn't got something right, acknowledging that, and really making sure, and I think that's why so many don't get escalated, that we cover every aspect of the complaint that comes in. So it's, you know, over a period of time, I think that's helped us to get to where we are.
Thank you. Do I have any further questions? No? Okay. Well, thank you, Belinda.
Okay, thank you.
Okay, so the next agenda item is the forward plan of executive decisions. We'll go through page by page like we normally do, and if anybody's got anything that they want to raise, then please do so. So the first page is our page 87, 88.
Mr. Chairman, I thought we were using the updated one that Paulina sent out.
Okay.
Slightly different page numbers.
I do apologise.
It was yesterday.
Have you got a copy of it? Because the one I've got is the old one. Okay.
I can't.
Pippa's got it, so she's going to read out the page numbers. Thank you. Actually, I've found it now, so we can crack on. Okay, so page 3. Nope. Page 4. Page 5. Page 6. Page 7. Page 8. Page 9. Page 10. Page 11. Page 12. 13. 14. Councillor Bull.
Thank you, Chair. Item 14 on page 14, what sort of provision is provided by Health Watch for over £500,000? I appreciate this used to sit with adults and communities before it came over to us, but I'm just wondering what kind of provision are we paying for there? It seems a lot of money to me, and I'm not sure what we get. In fact, I don't know what we get.
Okay. I believe that we have had a presentation from Health Watch as to the services that they provide at one of the meetings this year. Have we not?
I remember if it was this, I wasn't at one, but I think they did do one this year. I can go back and have a quick look at the agendas.
Okay. But if we want to put an action in, then we can put an action in that we would like further information about what we get for £500,000 from Health Watch.
That's precisely it, the costing for me, and what do we get back for that?
Okay. Have you got that, Pippa? Okay, thank you. Councillor Barkham, you had a comment as well?
Same question.
Okay, thank you. Page 15. Page 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38 is blank. Okay. Well, I do believe that brings us to the close of the meeting, and it's the last meeting of the year. So from a chair's perspective, can I thank all of the councillors who have been on the committee for the last year for your participation. I think the probing and the questioning has been really of a high standard, so thank you. And can also pass on my thanks to all of the officers who have ably assisted and also come here to be scrutinised and delivered the information that's been required and asked of in a very open and precise way. So thank you all. On that basis, thank you. Thank you. That's very kind. Thank you. On that basis, the meeting is closed.